दिक्कत नहीं है।
हाँ जी सर।
अगर लेट होता है ना एंड करने में, आपको लगता है कि टॉपिक रह गया, तो आप थोड़ा सा लेट भी कर सकते हैं।
ओके ओके।
दिक्कत नहीं है। हाँ जी सर। अगर लेट होता है ना एंड करने में, आपको लगता है कि टॉपिक रह गया, तो आप थोड़ा सा लेट भी कर सकते हैं।
Good evening everyone. I'm audible guys. Good evening everyone. Welcome to the session PSM high discussion. So in this session guys, we are going to discuss some high topics of PSM that are very expected to come in the exams. I'll be teaching you guys a few main important topics, and I will teach you guys how to approach to the particular questions in the PSM. Okay, so starting with the first discussion guys, the first question will be on the vitamins, and that's very repeatedly asked vitamin A question. Okay, so if I talk about vitamin first, a 2-year-old child with 7.5 kg weight with a vitamin A deficiency, oral dose of vitamin A given is. Okay, so let's discuss all the vitamin A in this particular question and then approach to the question accordingly. Okay guys, so if I talk about the first symptom of the vitamin A deficiency, if I talk about the first symptom of the vitamin A deficiency, that is night blindness. The first symptom of vitamin A deficiency will be night blindness. If I talk about the first sign, if I talk about the first sign of vitamin A deficiency, your answer will be conjunctival xerosis. Your answer will be conjunctival xerosis. Okay, if I talk about the most common clinical sign, if I talk about the most common clinical sign of vitamin A deficiency, then your answer will be bite or spot. Bite or spot. They can even ask sometimes the image. Okay guys, so this is a classical picture of a bite or spot. This is a classical picture of a bite or spot, and this is the most common clinical sign of vitamin A deficiency. Vitamin A deficiency. Okay, now if I talk about the most sensitive screening test, if I talk about the most sensitive screening test, then your answer will be serum retinol levels. Then your answer will be serum retinol levels. Okay, so this was all about a deficiency sign and symptoms guys, but usually what they ask is the question based upon the vitamin A dosage. Okay, so remember guys, if the question mentions that the age of the baby is less than 6 months, if it's less than 6 months, then the dosage will be, you guys can even comment down your answers as well, the dosage will be 50,000 international units. Then the dosage will be 50,000 international units. If the age is less than 1 year, if the age is less than 1 year, then your answer will be guys 1 lakh international units. 1 lakh international units. And if the age of the baby is more than 1 year, and if the age of the baby is more than 1 year, then your answer will be 2 lakh international units. 2 lakh international units. But there is a catch point in the question, my dear students, that the weight of the baby is less than 8 kgs. The weight of the baby is less than 8 kgs. So whenever in a question they will mention that the weight of the baby is less than 8 kgs, the dosage that you have to give at that time, you have to divide that by 2. So if I talk about here the age is 2 years, but as per the value, how much you have to give guys, you have to give 2 lakh international units. But I have mentioned if the weight of the baby is less than 8 kg, that's 7.5 kg, so at this time you have to give 1 lakh international units. Is that clear guys? Okay, so remember that whenever the weight of the baby is less than 8 kg, okay, less than 8 kg, then you have to give 1 lakh international units. Okay, 1 lakh international units. And this is a repeated question guys, it was asked back in 2023 June exams. Okay, after that guys, if I talk about total doses of vitamin A, how many doses we have in total? How many doses we have in total of vitamin A, guys? We have 9 doses. How many doses, guys? We have 9 doses. And if I talk about the total amount, if I talk about the total amount that you have to give vitamin A, how much, yeah, guys? Anyone in the comment section? Yes. Let's make this session interactive, guys. We have 17 lakh international units. Okay, guys, how much you have to give? 17 lakh international units. Is that clear? And you have to give this vitamin A, my dear students, every 6 months. You have to give this vitamin A every 6 months till the 5 years. Till 5 years. Is that clear? And the route of administration of the vitamin A is oral. Remember this, guys. They will give you the clinical question, guys. 1 lakh international units orally, 1 lakh international units intramuscular, 1 lakh international units intranasal. So you have to remember, guys, we give vitamin A orally. We give vitamin A orally. Is that clear? Now, if I talk about the richest source, let's discuss the sources, guys. If I talk about the richest source, of vitamin A, it's halibut oil. If I talk about the richest source of vitamin A, it's halibut oil. If I talk about the second richest, my dear students, your answer will be liver oil. Liver oil. And the most common source from the vegetables will be carrot. Is that clear, guys? So it was all about vitamin A. And remember one key point, my dear students, one key point you will remember, guys. 1 lakh international units. 1 lakh international units of vitamin A is equal to how many ml, guys? 1 ml. So remember that, guys. And the vitamin A is also known as which acid, guys? Anyone in the comment section? The vitamin A is also known as retinoic acid. It's also known as retinoic acid, and it's a treatment of choice for in dermat which conditions, my dear students? For acne. Now the side effect of vitamin A, if I integrate it with a bit of pharmacology, what is the side effect of vitamin A if the mother is taking in the pregnancy? What is the side effect of the vitamin A if the mother is taking in the pregnancy, guys? It's teratogenic. Okay, it can cause cleft lip and palate. Okay, also, guys, which drug causes that? Phenytoin also causes that. Is that clear, guys? So it was all about vitamin A. Okay, so let me revise it a bit, guys. If I talk about the first symptom, it will be night blindness. If I talk about the first sign, it will be the dryness, conjunctival xerosis. If I talk about the most common clinical sign, okay, guys, most common clinical sign, it will be bite out spot. Okay, this is a classical picture of the bite out spot, guys. Remember, image based question they can ask. I will later discuss also what are the primary signs of the vitamin A deficiency as per the WHO, what are the secondary signs of vitamin A deficiency. Okay, and if I talk about the most sensitive screening tests, your answer will be serum retinol levels. And if the age of the baby is less than 6 months, your answer will be 50,000 international units. If it's less than 1 year, it will be 1 lakh international units. And if it will be more than 1 year, it will be 2 lakh international units. And if it's less than 8 kgs, it will be 1 lakh international units. Is that clear? Okay, now richest source is halibut oil. Second richest is liver oil, and vegetable richest source is carrot. Okay, and after that, remember, guys, we have total of 9 doses, and total amount is 17 lakh international units, and you have to give every 6 months till the 5 years. Is this much clear, guys? So simple question was asked that age of the baby is 2 years, the weight is less than 8 kg, vitamin A deficiency, guys, your dosage will be 1 lakh international units. Your dosage will be 1 lakh international units. Is that clear, everyone? Whosoever is in the live session, clear to everyone, guys? Good. Let's move to the second question. A study was A study was conducted on a group of 500 patients having the carcinoma lung, and another group 300 was chosen from the general population. Both these groups were questioned on their exposure to smoking. What kind of study is this? So it's a it's a question from the epidemiological studies, my dear students. So let's break the question and understand what question is talking about. Okay, so a study was conducted. If I talk about brief studies of the epidemiology, guys, we have 4 studies mainly that we do. First is cohort study, then the case control, then cross-sectional study, and then the cross-sectional study, then ecological study. Is that clear? So if I talk about these 4 studies, guys, either we are doing a study at a point in time, either we are doing a study in the forward direction, or either we do study in the backward direction. Okay, so in this question, guys, a study was conducted, and how many patients were participating in this study, guys? 500 patients, and they have a carcinoma lung. They have a carcinoma lung. Okay, and group of 300 was chosen from the general population, and both these groups were questioned. Now, guys, patients already have what? Carcinoma lung. That means disease is already present. Disease is already present. Okay, now we are questioning them. Okay, we are questioning them. Okay, let's assume this, guys, this is a present condition. Okay, guys, they have carcinoma lung. Okay, guys, they have carcinoma lung. Okay, now in this condition, guys, in this condition I'm going back. I'm asking them in the past that, okay, you guys have cancer in the present, so do you have an exposure to smoking? So when you're going back to the past, guys, it's called backward study. It's called backward study. Okay, and you guys know, guys, you guys know that if I talk about a backward study, if I talk about a backward study or retrospective study, that study is called as case control study. That study is called as case control study. Is that okay? And now if I'm talking that I'm going in a forward direction, okay, if the same study I'm doing, guys, for example, patient are smokers. Okay, patient are doing smoking. Okay, and smoking is a risk factor to smoking is a risk factor to smoking is a risk factor to lung cancer. Smoking is a risk factor to lung cancer. And now from smoking to the lung cancer, it will be which direction, guys? I'm going into the forward direction. I'm going into the which direction, my dear students? I'm going into the forward direction, and this forward direction study is called as cohort study. This is called as cohort study. Okay, so did you understand, guys, when I'm talking about past, when I'm going into the back in the time, guys? For example, disease to the risk factor, okay, outcome to the exposure, that study is called as case control study. Here the carcinoma lung was already there. Patient had a carcinoma lung, and after that we are asking the patient, do you have an exposure to the smoking? Such type of study is called as case control study. So let's discuss a bit. Okay, guys, a case control study. What exactly case control study is? Case control study. So if I talk about case control study, guys, it's also called as backward study. It's also called as backward study, or it's also called as retrospective study. Or it's also called as retrospective study. It's also called as outcome to exposure study. It's also called as outcome to exposure study. So if I talk about in this question, guys, simple. See, the the outcome was the smoking, and sorry, the outcome was the carcinoma lung, and I'm going into the back into the time. Okay, what was the exposure, guys? Smoking. So when I'm going back in time, when I'm going from the present and back in time, such kind of study is called as case control study. Such type of study is called as case control study. Okay, and remember, guys, in this type of study, guys, it is very fast study. It's very fast study. What do I mean by this very fast study, guys? For example, if I'm talking about a cohort study, in cohort study, guys, first of all, I need to arrange a group of people who are smokers. Okay, for example, these 10 people are smokers. Okay, then I will wait for the 10 years. Then I will wait for 10 to 15 years that they will have a carcinoma lung, and in these 15 years, my dear students, I have to do continuously follow up for these patients to check the conditions of the lung, right? So I need to wait for the forward study. I need to wait for the 10 years, for this 10 to 15 years for the cohort study to get the result, to get the outcome, that is a cohort study, forward study. But when I talk about same in the case control, that is a backward study. But in backward study, guys, I have already the outcome. Patient is already having the lung cancer. I'm directly asking the history to the patient, and patient is telling me, yes, I had an exposure to the smoking. So that's why this case control study is a fast study. Is that clear, guys? That's why the case control study is a fast study. So after that, guys, can I write it also that no follow-up needed? No follow-up needed. Okay, because the outcome is already present there, so you don't need to follow up the patient. Is that clear? Okay, and then, guys, the strength of association. The strength of association is given by odds ratio. The strength of association is given by odds ratio. So you have to remember, guys, these things, that when I'm talking about back in the past, the type of the study we have, case control study, it's also called as backward study, it's also called as retrospective study, it's a very fast study, guys, it's called outcome to exposure study, no follow-up needed in this study, and the study strength of association is given by the odds ratio. Okay, now simple, guys, simple. Let me clear it. Cohort here only. Cohort study, guys, directly, guys, it's opposite to the case control. It's opposite to it's opposite to this case control. Okay, so if I'm talking about this is a backward study, then this will be guys, forward study. If it's retrospective, this will be prospective. If this is outcome to exposure, this will be exposure to outcome. Is that clear? If this is a very fast study, it's a slow study. No follow-up needed, and here follow-up is needed. That's how you will get to know about the outcome of the exposure. Is that clear? And guys, here the strength of association is given by, if I talk about here, strength of association is given by, you have to remember these things, guys. Strength of association is given by a relative risk, attributable risk, and population attributable risk. Is that clear? And also, my dear student, incidence is also checked in which study, guys? Cohort study. Okay, it's also checked in cohort study. So remember, guys, remember, whenever in a question they are mentioning that relative risk is calculated, attributable risk is calculated, population attributable risk is calculated, incidence is calculated, so your answer will be what, guys? Cohort study. Okay, then you will approach to the question again, from which side, guys? Whether the whether the question is talking about in the future or it's going into the past. Okay, so this was all about case control and cohort study. Cross sectional study, guys, it's done at a point time, guys. This cross sectional study is also called as snapshot study. Okay, it's done at a point, and prevalence is checked in this type of study. Prevalence is checked in this type of study. If I talk about ecological study, guys, in ecological study, my dear students, it tells us about the characteristic of the population. It will tell us about the characteristic of population. Okay, we'll have a detailed video coming very soon for the epidemiology, guys. I will discuss everything in a detail here. It's just a high discussion, guys, how to approach to the questions, what are the things you have to what are the hints in a question you have to find to land in the right answer. Is that clear? So is that clear, guys? In the comment section, guys, you guys can type it down. All clear? What is case control and cohort? So forward direction, guys, it will be cohort, and backward direction it will be case control. Okay, let's move to the next question. Again, guys, this exam, it was the question asked. So which of these is the correct dosing schedule according to the given program logo? If the given program logo, what is this guys? It's Anemia Mukt Bharat. It's Anemia Mukt Bharat logo. Okay. If I talk about Anemia Mukt Bharat, if I talk about Anemia Mukt Bharat, my dear students, that strategy in this is 6 into 6 into 6 strategy. What is the strategy, my dear students? 6 into 6 into 6 strategy. What does that mean, guys? 6 beneficiaries, 6 interventions, and 6 institutional mechanism. Okay, guys, 6 beneficiaries, 6 institutional mechanisms, and 6 interventions. Okay, now let's study about this, guys. This strategy was implemented to reduce the anemia in the country. Okay, guys, to reduce the anemia in the country. Okay, and let's talk about this logo in the detail, guys, because eventually they are asking these questions multiple times. Okay, if I talk about FMG 2023 July, they ask, guys, 6 into 6 into 6 strategy. If I talk about the previous exams, Jan 2024, they asked the same question, guys. What is the amount of dosage you will give in the patients having the anemia? Okay, so remember, guys, the age. If I talk about 6 months to 5 years, if I talk about 6 months to 5 years, the dosage of iron will be 20 mg. The dosage of the iron will be 20 mg. If I talk about folic acid, guys, it will be 100 micrograms. It will be 100 micrograms. And if I talk about frequency, my dear students, you have to give this twice a week. You have to give this twice a week. Okay, if I talk about 6 years to 10 years, if I talk about 6 years to 10 years, you have to give iron 45 mg, and folic acid you have to give 400 micrograms. Folic acid you have to give 400 micrograms. And frequency, again, guys, you have to give twice a week. Frequency, again, you have to give twice a week. If I talk about, guys, 10 years to 19 years, if I talk about 10 years to 19 years, the amount of iron given is 60 mg, and the folic acid you have to give is 500 micrograms, and you have to give this weekly. If I talk about 19 years to 49 years, the dosage of the iron will be 60 mg, and folic acid will be 500 micrograms. Again, you have to give this weekly, guys. Now the main part, guys, remember these two main, that's what they ask. If I talk about pregnancy and lactation, if I talk about pregnancy and lactation, the amount of iron will be 60 mg, and folic acid will be 500 micrograms, and you have to give this, guys, daily. You have to give this daily. So this is the intensified iron plus initiative that is called as Anemia Mukt Bharat, which was a strategy implemented in the country to reduce incidence and prevalence of the anemia cases. Okay, and as per that, guys, the given question asks that which of the following is correct. Okay, guys, so in a pregnant lady, what will be the answer, guys? Write down in the comment section what will be the answer, guys. What is the dosage of an folic acid and iron in case of a pregnancy? What is the dosage? What is the dosage, guys? What will be the answer? A, B, C, or D? Everyone in the comment section, what will be the answer? Perfect. Okay, so your answer will be, guys, yes, C. 60 mg of elemental iron and 500 micrograms of folic acid to the pregnant woman daily. You have to give. Okay. Now, if I talk about this folic acid, guys, if I talk about this folic acid, why this folic acid is important in the pregnancy, guys? Deficiency of folic acid will cause neural tube defects. Deficiency of folic acid will cause neural tube defects. If I talk about most common neural tube defect, guys, it's spina bifida. Let's integrate it a bit, guys, with the gynecology. If I talk about guys, most common neural tube defect, it's spina bifida. Okay. And if I talk about most common spina bifida, guys, it's spina bifida occulta. It's spina bifida occulta. Okay. And second thing, guys, the two signs that we have in spina bifida, guys, remember that in the cerebellum we have those signs, lemon sign and banana sign. What are the two signs, my dear students? We have lemon sign and banana sign. Okay. After that, guys, remember how much folic acid generally, not as per the Anemia Mukt Bharat, generally how much folic acid you have to give? 0.4 mg daily. Okay, if the question asks as per Anemia Mukt Bharat, then you will only mark 500 micrograms. Okay. Then if I talk about history of neural tube defect, if a patient is having the history of neural tube defect, then how much folic acid you have to give, guys? 4 mg daily. Then you have to give 4 mg daily. Is that clear, guys? So patient with a history of neural tube defect, you have to give 4 mg daily, and patient with not a history of neural tube defect, you have to give 0.4 mg. Okay. And if I talk about folic acid, guys, it's vitamin B9, right? So vitamin B9 will cause which anemia? Vitamin B9 causes, remember, guys, it causes megaloblastic anemia along with vitamin B12. Okay. It causes which anemia, guys? It causes megaloblastic anemia. And also, which vitamin causes megaloblastic anemia? Vitamin B12. Vitamin B12. Now, a classical case I will tell you, guys, if you have a patient coming with the megaloblastic anemia, how do you differentiate clinically? Okay, I know in the biochemistry you have studied MMA levels and homocysteine levels, but how do you differentiate clinically, guys? Remember that if the patient is having a neurological deficit features, then you will go with the B12. Okay, why you will go with the B12 at that time? Because the myelin sheath is developed because of the vitamin B12. Okay, and if there is a deficiency of vitamin B12, what will happen? There is a degeneration of the myelin sheath, and that's why the patient will complaining of the neurological features. Is that clear? So remember that, guys, megaloblastic anemia is caused by B9 deficiency and B12 deficiency. This B12 deficiency is also seen in, guys, vegetarian people. Okay, guys, this is also seen in the vegetarian people. Is that okay? And if I talk about the pregnancy, what is the most common anemia in the pregnancy, guys? If I talk about pregnancy, guys, most common anemia in pregnancy is nutritional anemia. Most common anemia in pregnancy is nutritional anemia. And what is the cutoff, guys, my dear students? Less than 11 grams per deciliter. You can call it as patient is anemic. One more catch, guys, remember that if the patient will, I'm teaching a bit in a gynecological aspect, guys, if the patient will mention what will be the iron dosage in pregnancy, not as per the Anemia Mukt Bharat. As per the Anemia Mukt Bharat, you will already know 60 mg of iron and 500 micrograms of folic acid. But if they don't mention that as per the Anemia Mukt Bharat, then your answer will be, guys, 100 mg iron. Then your answer will be 100 mg iron. And when it is moderate, mild, 100. If it's moderate to severe anemia, then 200 mg iron daily. Then 200 mg iron daily. Okay, so this was all about anemia in pregnancy. Also, one more point I'm gonna add as per the gynecological aspect, guys. When the patient is having anemia in pregnancy, deworm the patient also, because worms can also cause the anemia. Which worm can cause anemia, my dear students? Hookworm. Remember that hookworm causes iron deficiency anemia. Hookworm causes iron deficiency anemia. So that's why it's mandatory to deworm the patient with albendazole and mebendazole. Okay, that's why we deworm the patient with albendazole or mebendazole, because sometimes in pregnancy, guys, hookworm can cause iron deficiency anemia. Okay, so what is this nutritional anemia, guys? Nutritional anemia is iron deficiency anemia plus megaloblastic anemia. So this was all about, the Anemia Mukt Bharat. Okay, I'll again repeat it in a very fast, guys. I will again repeat it. Remember that in the pregnancy and lactation, guys, how much you give? 60 mg of iron and folic acid 500 micrograms. What is the main aim of this folic acid, guys? To decrease the chances of the neural tube defect. Okay, most common neural tube defect will be spina bifida, guys. We have other neural tube defects as well. Okay, but you will remember the most common spina bifida will be spina bifida occulta. Okay, and the two signs that will be present, we have lemon sign and banana sign. Okay, and the strategy for Anemia Mukt Bharat is 6 into 6 into 6 strategy, where 6 stands for beneficiaries, 6 stands for institutional mechanisms, and 6 stands for interventions. Okay, if the patient with a history of neural tube defect, guys, then 4 mg daily. One more NEET PG question was there, guys. How to diagnose this neural tube defect in pregnancy, guys? Remember that acetylcholinesterase. Remember, guys, acetylcholinesterase in amniotic fluid. Acetylcholinesterase in amniotic fluid is 100% confirmatory of neural tube defect. Okay, so you have to check, guys, acetylcholinesterase in the amniotic fluid. That will tell us about, guys, what? That will tell us about the neural tube defect. That will tell us about the neural tube defect. So it was all, guys, all clear. It was all about Anemia Mukt Bharat and a bit integration from the medical aspect and PSM aspect and medicine aspect way. Okay, now next question, guys. Okay, the physical quality of life includes the following parameters. The physical quality of the life includes the following parameters except. Okay, guys, so let's discuss about the indicators of quality of life. Okay, let's discuss about the indicators of quality of life. So we have a lot of indicators, guys, so indicate the quality life, but main two indicators that the question can be expected from. The first one be PQLI. What is PQLI, guys? Physical quality life index, and HDI, human developmental index and physical quality life index. Okay, so if I talk about the components of PQLI, the components are life expectancy at 1 year of age, life expectancy at 1 year of age. Second will be literacy rate. Third will be infant mortality rate. So what are the three components you have to remember, guys? The first will be life expectancy at the 1 year of age. The second will be literacy rate, and the third will be infant mortality rate. Remember always, guys, the range of the PQLI is from 0 to 100. The range of PQLI is 0 to 100. Okay, and if I talk about the current value of India of PQLI, it's 71. The value of India is 71. Okay, and if I talk about human developmental index, the components, the first component will be life expectancy at birth. Okay, second will be literacy rate. And the third will be income. If I talk about range of HDI, that's 0 to 1. And the value is 0.645. Okay, so it's all about PQLI and HDI. Okay, how to indicate the life, guys? You have to check the life expectancy at the 1 year of age. You have to check the literacy rate and you have to check infant mortality rate. Okay, remember that we have a different names for literacy rate, guys. Rather than mentioning the literacy rate, they can mention in options educational index, they can mention educational index. The second will be, guys, mean year of schooling. It can be mean year of schooling, and it can be knowledge. So the other names that they can mention, guys, they can mention, rather than mentioning in options literacy rate, they can mention educational index, they can mention mean year of schooling, or knowledge. Okay, the other indicators of the quality life that we have multi-dimensional poverty index, we have multi-dimensional poverty index, we have human suffering index, we have human suffering index, and we have human poverty index. And we have human poverty index. Okay, so it was all about the PQLI and HDI, guys. Let's come back to the question. PQLI, physical quality of life, includes the following parameters except infant mortality rate. Okay, yes it is. Life expectancy at age, yes it is. Education or literacy rate or knowledge, yes it is. Life expectancy at birth is not a component of a PQLI, it's a component of an HDI, human developmental index. Okay guys, human developmental index. Is that okay guys? Okay, so it was all about PQLI and HDI. It was all about PQLI and HDI. Okay, done. There is no concept behind this indicators of life. You just have to remember that that's what PSM is all about. Okay, so wherever I can integrate it a bit with the other subjects in a clinical aspect, guys, I will try it, but there is no integration in this way. Okay, so let's move to the next question, guys. From the occupational diseases, a person with a history of 30 years working in the cardboard manufacturing industry develops the breathlessness. Okay guys, develops the breathlessness, and the cough x-ray shows the mottling in the lungs, the disease most likely he is suffering from. Okay, the patient is working in the cardboard manufacturing industry, guys, so that is a hint of which cardboard is made from the sugar cane dust. Okay, so so sugar cane dust is the hint for the which pneumoconiosis, guys. So let's discuss all the pneumoconiosis first. Okay, so remember guys, whenever the diagnosis in this condition, remember the diagnosis in this condition is bagasosis. The diagnosis in this condition is bagasosis, and in bagasosis, guys, the dust we have is sugar cane dust. The dust we have is sugar cane dust. Let's talk about all the pneumoconiosis one by one. Okay, so if I talk about the most common pneumoconiosis, if I talk about most common pneumoconiosis, the most common pneumoconiosis we have silicosis. Okay, in silicosis we have silica dust. In silicosis we have silica dust, or guys, stone dust. The examiner can give the hint silica dust, the examiner can give hint the stone dust, the examiner can give you the hint cement industry. Okay, so all these conditions, guys, your diagnosis will be silicosis. Your diagnosis will be silicosis. Okay, most important part, guys, the patient who are having the silicosis, guys, have continue follow-up for which condition, guys? Tuberculosis. Okay, because these are more patients having silicosis, guys, or the patients working in the cement or stone industry, guys, they are more prone to the tuberculosis. Number one thing, guys. Number second thing, guys, if I talk about the chest x-ray of the silicosis patients, we have a appearance called as snowstorm appearance. We have which appearance, guys? Snowstorm appearance. And we have calcification called as eggshell calcification. Okay, we have a calcification called as eggshell calcification. Okay, so remember, guys, most common pneumoconiosis is silicosis. It's associated with which industry, guys? It's associated with stone or cement industry. Okay, and follow-up, patient will have a follow-up for the TB. Okay, the chest x-ray will have snowstorm appearance or eggshell calcification. Okay, after that, guys, if I talk about asbestosis, if I talk about asbestosis, if I talk about asbestosis, guys, remember, guys, it's due to the asbestos dust. It's due to the asbestos dust. Okay, and which industry mainly, guys, we have? We have glass industries. We have glass industries, and it's the only pneumoconiosis. It's the only pneumoconiosis that is associated with malignancy. It's the only pneumoconiosis that is associated with malignancy. Okay, after that, remember, guys, sorry, I'm not feeling that well, guys, sorry for the interruption. Chalo, it's associated with the malignancy. Okay, the most common malignancy, okay, is adenocarcinoma of lung. The most common malignancy is adenocarcinoma of lung. And if I talk about more specific, malignancy, guys, associated with the asbestosis, guys, remember, it's mesothelioma. Mesothelioma of pleura. You just remember mesothelioma. Okay, and mesothelioma, we have a characteristics bodies, guys. What are the bodies? What are the bodies that are seen? They are called samoma bodies. In mesothelioma, we have a bodies called samoma bodies, and these samoma bodies will also seen in which condition, guys? Papillary thyroid cancer. And what is the other histopathology finding of the papillary thyroid cancer, guys? We have orphan ani nuclei. We have orphan ani nuclei. Okay, and apart from that, they are also found in ovarian tumor, and also they are found in meningioma. They are also found in meningioma. Okay, they are calcium centered pathological bodies, inclusion bodies seen in these conditions. Mesothelioma and meningioma, papillary thyroid cancer, and ovarian tumor. If I talk about, guys, the bodies, asbestos bodies, these asbestos bodies are called as Ferguson bodies. Okay, asbestos bodies. Okay, then, guys, the next one is anthracosis. So let me write anthracosis, guys. Let me write anthracosis. Where? Let me write anthracosis here. Okay, let me discuss anthracosis. If I talk about anthracosis, my dear students, the agent is coal dust. The agent is coal dust. Okay, and patient will have a massive fibrosis. There is a progressive massive fibrosis. There is a progressive massive fibrosis. Okay, after that, my dear students, if the patient along with the anthracosis, will have rheumatoid arthritis, your answer will be Kaplan syndrome. It's diagnosis of the Kaplan syndrome. Okay, that's why it is also called as rheumatoid pneumoconiosis. That's why it's also called as rheumatoid pneumoconiosis. Now, if the patient is having anthracosis, plus rheumatoid arthritis plus splenomegaly then your answer will be, guys, Felty syndrome. Then your answer will be Felty syndrome. Then your answer will be Felty syndrome. So it was all about pneumoconiosis, my dear students. We have one more pneumoconiosis, guys, associated with the cotton dust. I'm writing here it down. I'm writing here. We have one more, guys, Bisinosis. And Bisinosis, guys, it's the agent is the cotton dust. And there is also Monday chest tightness. Monday chest tightness. There is also Monday chest tightness. Is that clear, guys? Okay, so it's all about different pneumoconiosis. Okay, so let me discuss from the beginning again, guys. The patient was working in the sugarcane dust or the sugarcane industry. Hint was cardboard manufacturing, guys. The x-ray shows the mottling of lungs. Again, you have to remember the mottling of lungs. In which pneumoconiosis we have bagasosis, guys. Then the second one was asbestosis. In asbestosis, guys, the patient has exposure to the asbestos dust or the glass industry. Then the only pneumoconiosis that is associated with the malignancy, guys. If the question mentions the most common malignancy, it will be adenocarcinoma of the lung. If the question mentions most specific, it will be the mesothelium of the pleura. And the pathological bodies that we have in the bodies that we find in the mesothelium are the samoma bodies. Okay, and these samoma bodies are also seen in which conditions? Meningioma, papillary thyroid cancer, and ovarian tumor. Is that clear? And then the most common pneumoconiosis, if I talk about, is silicosis, guys. Most common pneumoconiosis is silicosis, and there is a silica dust there, okay, with the cement industry. Okay, guys, patients who are working in the cement industry. Okay, the most common pneumoconiosis will be silicosis. That's why the patient will have a continuously follow for the tuberculosis. Okay, and the chest x-ray will show the snowstorm appearance and the eggshell calcification. Is that okay, guys? Eggshell calcification. Okay, if the chest x-ray shows the popcorn calcification, let me write here. If the okay, let me tell it verbally, guys. If the chest x-ray shows the popcorn calcification, then your diagnosis will be then the diagnosis will be, yes, most common, most benign tumor of the lungs, hematoma. Okay, guys, pulmonary hematoma. Okay, so remember that as well. And if the snowstorm's appearance we have on the USG, the diagnosis will be hydatiform mole. Is that clear? And then we talked about the anthracosis, guys. The agent is the coal dust. And if the patient is having anthracosis plus the rheumatoid arthritis, your answer will be Kaplan syndrome, which is also called as rheumatoid pneumoconiosis. That means rheumatoid arthritis with the pneumoconiosis, anthracosis. Okay. And if there is an anthracosis plus rheumatoid arthritis plus splenomegaly, your diagnosis will be Felty syndrome. And if the patient is working in the cotton dust or exposure to the cotton dust, he will have a Bisinosis. Airspace industry. Okay, guys, Berylliosis. Write it down, guys. I don't want to skip it a bit. Let's write it. Berylliosis. Airspace industries. Berylliosis. Okay, so that was all about the pneumoconiosis. Is that clear? So Bisinosis, Berylliosis, bagasosis, silicosis and asbestosis. Let's move to the next question, guys. A patient with 3 hypopigmented anesthetic patches. That is a key point, guys. 3 hypopigmented anesthetic patches with 1 thickened nerve. The nerve involved is ulnar nerve present to your OPD. What shall be your treatment approach? Your diagnosis is simply leprosy. What is the diagnosis, my dear students? Your diagnosis is leprosy. Okay, guys, caused by Mycobacterium leprae. caused by Mycobacterium leprae. Let's discuss, guys. We have two types of leprosy, guys. We have paucibacillary. We have paucibacillary and we have multibacillary. We have paucibacillary and we have multibacillary. If I talk about paucibacillary, my dear students, the number of skin lesions we have 1 to 5. But if I talk about multibacillary, guys, the skin lesions we have more than 5. The skin lesions we have more than 5. Okay. If I talk about the drugs, my dear students, we have rifampicin, we have dapsone, we have rifampicin, we have dapsone, and we have clofazimine. Okay, these are the three drugs that we use in paucibacillary. And in multibacillary, guys, again the same drugs you have to remember. The three drugs, rifampicin, which is also used in anti-TB first line treatment, guys, and with a side effect of orange color secretions. We have dapsone. Dapsone is a drug of choice for also dermatitis herpetiformis, guys, gluten insensitivity, celiac disease, that's a risk factor as well. And guys, also clofazimine. This clofazimine is also a second line drug for the TB as well. Okay, so remember, guys, the drugs we have rifampicin, dapsone, and clofazimine. If I talk about the duration of the treatment in paucibacillary, guys, it's 6 months. The duration here is 6 months, and if I talk about duration here, it's 12 months. Its duration of the treatment is 12 months, and here the duration of the treatment is 6 months. And guys, here you have to follow up yearly for 2 years. And here yearly for 5 years. Follow up yearly for 5 years. So it was all about paucibacillary, guys, and multibacillary. So here, guys, there are 3 hypopigmented patches. So 3 lesions. Your diagnosis is paucibacillary. Your diagnosis is paucibacillary because of 3 lesions. And what will be the drug, guys? 3 drugs you have to give for how many months? 3 drugs you have to give for 6 months. Okay, guys, 3 drugs you have to give for 6 months. Is that clear? Yes? All clear, guys? So remember, guys, skin lesions, you have 3 drugs, rifampicin. 1 to 5 in paucibacillary, you have rifampicin, you have dapsone, you have clofazimine. And then you have to give it for 6 months and follow up for how many years? 2 years. And here, guys, skin lesions are more than 5. Drugs you have to give is rifampicin, dapsone, and clofazimine. And you have to give the treatment for almost 12 months. And you have to go for follow up yearly for 5 years. Is that clear? And the question, guys, was simply mentioning that what will be your treatment approach, guys? You have to give for 6 months these 3 drugs because it's a paucibacillary. Okay, and if it would have been 6 hypopigmented patches, then it would have been option D, 3 drugs for 12 months. One more important question that they ask is lepra reaction, guys. Let me tell you about lepra reaction. From the recall 2023, simple was asked type 1 lepra reaction, which will be which type of hypersensitivity reaction. So you have to remember in lepra reaction, you have to remember rule of 5. क्या याद रखोगे, guys? Rule of 5. तो rule of 5 का मतलब क्या होता है? If I talk about type 1 hypersensitivity reaction, what you will add to 1, it will become 5, guys. So type 4 hypersensitivity reaction. Okay. And type 2 hypersensitivity reaction, type 2 lepra reaction, how do you remember, guys? What you will add to 2, it will become 5. That's type 3 hypersensitivity reaction. Okay, the nerve that is involved in the leprosy is ulnar nerve. The nerve that is involved in is ulnar nerve. If they ask the which cranial nerve is involved, if cranial nerve asks, remember it's facial nerve. If cranial nerve asks, it's facial nerve. That's all about leprosy. That's all about leprosy. Okay guys, all clear? Chalo guys, so remember guys, this leprosy is important as well. Let's move to the next question guys. Asha worker. So always remember, what are the hints guys? Asha is going for a house visit. Okay, that means which surveillance guys? Active surveillance. Okay, health worker is going to home and taking the guys investigations or giving the treatment. What is passive surveillance? A diseased person is going to the hospital and taking the treatment. And the one more type of surveillance, we have sentinel surveillance. And what do I mean by this sentinel surveillance? It's particularly for the sexually transmitted diseases. Okay, so who is going for the house visit guys? Asha is the hint. Asha worker, accredited social health activist, the full form. Sometimes FMG exams, they can even ask these questions. Asha worker during her house visit in a village of Bihar. So Bihar is another hint guys. So if I talk about the epidemiology of the disease, the place it is found in mainly is Bihar. So Bihar is the hint. Asha is the hint. She came across a patient with a complaining of fever, weight loss for 3 months. Okay, fever, weight loss for 3 months. Okay, she noticed that the skin was dark and abdomen was distended. She performed the test. What is the name of the test guys? RK39 dipstick test. What is the name of the test, my dear students? RK39 dipstick test on the urine, which turned to be positive. The probable diagnosis is, okay guys, the probable diagnosis is, you have to remember guys. So let's write, whenever so many hints are given guys, West Bengal, Bihar, UP, you know, Asha is going for the visit, and most important, RK39 dipstick test. So your diagnosis is, my dear students, leishmaniasis. Your diagnosis is leishmaniasis. So let's write about leishmaniasis. Let's discuss everything. Okay, it's caused by L. Donovani. It's caused by L. Donovani. Okay, also guys, it's caused by L. tropica. Okay, that causes cutaneous leishmaniasis. Remember guys, L. Donovani causes visceral leishmaniasis, and this visceral leishmaniasis, it is also known as Kala Azar. Yaad rakhna guys, Kala Azar. And if I talk about L. tropica, my dear students, this L. tropica, it causes cutaneous leishmaniasis. It causes cutaneous leishmaniasis. Okay. After that guys, remember the test that we do for leishmaniasis is RK39 dipstick test. RK39 dipstick test. If I talk about the intracytoplasmic inclusion bodies, if I talk about intracytoplasmic inclusion bodies, the intracytoplasmic inclusion bodies that are found are called LD bodies, and they are confirmatory for the test. Remember this as well, are called LD bodies. Okay, if I talk about the drug of choice for the condition, the drug of choice is L-amphotericin B, liposomal L-amphotericin B. How much to give, my dear students? 10 mg per kg, 10 mg per kg single infusion. Okay, single infusion. We also do one immune test called as leishmania test. Remember guys, but that is not a diagnostic test. we also do leishmania test. So that was all about the leishmaniasis. Okay guys, leprosy is also done. Let me tell you a bit about filariasis guys. I'm only telling you the